when I saw him back, he brought the brochure back and it looked kind of dried out and cracked. He said, I've been putting it in the microwave and putting the brochure on my face, and it hasn't helped me much. I had to crack up. I said, I can't believe it's not the brochure that you put in the microwave. It's the mask that you have to put in the microwave.
Dr. Matossian, thank you so much for joining us this evening. I'm really happy to have you here out of your busy schedule. And I want to just enlighten you on what we're doing. It's called Focus Through the Generations. And we are interviewing active practicing ophthalmologists in 4 different generations that are happening in our world right now, which is, to me, amazing, just amazing. So I want to thank you again for joining us. I'm going to ask you some questions and we're just going to have a really fun time.
I can't wait. First, thank you, Polly, for inviting me. I'm honored to be included among your ophthalmologists whom you're interviewing, and I can't wait. We're here, and I'm delighted to be part of your series.
Thank you so much. I want you just to introduce yourself to the audience and tell them a little bit about you. I know pretty much everybody probably knows you in the industry, but let's just give them a little pearl. Tell them something about you.
Sure. I'm Cynthia Matossian from Matossian Eye Associates. I started the practice many years ago. Actually, it was June of 1987, with 1 technician, 1 exam room, and 1 receptionist who was working part-time. And since then, I've worked hard and with the support of a lot of people, including my family, my husband, I was able to grow the practice to the point where we now have 3 offices in Pennsylvania and New Jersey with a very large number of physicians, including all the subspecialties like glaucoma and oculoplastics, retina, cataract, and so forth. And we're an integrated ophthalmology optometry practice. And almost 2 years ago, I sold the practice to a PE-backed entity called Prism Vision Group. So I am no longer the owner of Matossian Eye Associates.
But they kept your name.
What a journey from beginning to now.
Well, you started a year before me. My first job in ophthalmology was 1988. In Florida as an administrator. It was a job I hated to love at the time, but it worked out really well.
Right.
So I've never strayed from ophthalmology since then. It got me and kept me, so I've enjoyed it.
And that's what they say about ophthalmology. Once you find it and it finds you, you never let go. It magnetizes you back, no matter how hard you try to leave. Fortunately for me, I feel so lucky that I found ophthalmology and it found me. I've been passionate about the field since I started in my residency.
I agree. And I say ophthalmology, I tell everyone here when I'm training them on ophthalmology is a beast all its own.
Yes.
We are not like any other specialty. Our group is different. Our peers are different. Our fan base is different. Just our meetings are different. Our industry is different. I don't even know how to describe it. I've been in other industries, but I've yet to be in an industry that I've loved more than ophthalmology. So I'm really happy I landed here and met people such as yourself.
I agree. It's like an extended family. When I go to big national meetings, as big as the meetings are, it still feels like a big family gathering because we all know each other. It's a small world. And I think most everybody is incredibly kind and generous and supportive of one another. That's what I love about our field.
I agree 1000%. I always call it old home week when I get to go to a meeting and meet my family I haven't seen in a year because I've only seen them at this one meeting. I have a question for you. What do you think is the biggest problem facing ophthalmology today, facing our industry?
Well, we have, I think, a bunch of problems facing our industry. And the biggest one, in my opinion, is the disconnect between the cost of doing the business of ophthalmology and the reimbursement that we're getting in return. Right now, to operate a state-of-the-art cutting edge ophthalmology practice requires a lot of pieces of equipment. The lifespan of the pieces of equipment is getting shorter and shorter, meaning that there are newer versions that you have to constantly upgrade to, or new pieces of equipment that are coming in that we never had before. The cost of staff is increasing because you need more educated staff to operate these more sophisticated pieces of equipment. It's not just checking vision anymore and writing a Snellen visual acuity in a chart anymore. And unfortunately, on the flip side, the reimbursement is going um, down, and it's hard to make that balance. So you have to be inventive and creative and include cash paying procedures to profit and to become successful.
It's true, very true. I agree with everything you just said, and I have to tell you that your peers have pretty much voiced the same thing. So I know that has to be our biggest. What is our biggest opportunity in ophthalmology right now?
We are so fortunate that we can help people with their vision. And we can now expand the range of vision and correct presbyopia in so many different ways, not only through contact lenses and spectacles for our optometry colleagues, but also through lens-based surgery, whether a refractive lens procedure in a clear lensectomy, or after a cataract procedure, we can expand the range of vision up appropriately, of course. And also now, very soon down the pike, we're going to be getting presbyopia correcting drops, where with a drop or two per day, we're going to be able to read better up close under most lighting conditions. And again, that will be a bridge between the onset of presbyopia and lens-based surgery.
I can't wait for that, honestly. I mean, that's the one hole is presbyopia.
Yes,
And
I think
it's,
that's the biggest thing.
yeah, I love it. And with all the next generation coming into their 40s, that's going to be a rather huge um, treatment path for them
Yeah.
to take. And I think this generation too, you can tell me what you think, but I think that generation coming into their 40s now is going to be more apt to use a drop than maybe to have a surgery, where, the boomers, we were used to the surgery. So we just, yeah, okay. But I think they're going to be more apt to try the drop, something more conservative than the surgery.
And because they have the option to try it. We never had that. It was either surgery or wear glasses all the time. So I think the drop is going to help a lot of patients in that, or doctors, or people really in that interim phase as a bridge. And obviously, when the lens becomes blurry and opacified enough, there is no alternative but cataract procedure. And by then, we may even have more options with implant types to correct presbyopia.
I agree. I love that. Who or what, Dr. Matossian, has influenced your life the most and why?
That's a very good question. I would say my mom. She is 96 and a half years young right now. She has always believed in me and encouraged me to get my education and to persevere, even when hurdles have come up in life. And my husband has always been by my side, encouraging me and being my supportive person on whom I can lean through happy times and challenging times. So I've been extremely fortunate to have that kind of love around me, which has made me confident and kind of pursue and take risks that I perhaps otherwise may not have taken.
We share that. My mom is my biggest influencer as well, and still my biggest supporter out of all the people in my life. She is my biggest supporter and pushes me, just like your mom. What is your favorite thing to do in your downtime?
I study wine, and I love trying different wines and comparing them, contrasting them, pairing them with different food types. And I really study it like a science, the different grape varietals. And what's nice is that not all everywhere in the world, but in many parts of the world, when my husband and I travel, we go to vineyards or we go to distilleries or we go to breweries and taste wines and spirits. Or my husband likes beer. I'm not a big beer drinker, but it's so nice to be able to travel the world and savor the different spirits all around.
I love that. I also love wines, and that was we were just talking about this. That's one of the things I want to study. I would love to join a wine club, and be able to do more with that and study more with that because it's really interesting and it tastes good. So it's a great hobby.
Exactly. It's a great hobby. And there's always a cause to open a bottle of wine, with dinner to celebrate a birthday or an anniversary. So whether it's a sparkling wine or a flat wine, a dessert wine, it's great. I love the field.
Well, while we're on wine, I have to ask you, what is your favorite wine? Maybe not the brand, but a wine, a type.
I get asked that question a lot. It depends actually what I'm eating and whether I'm having it before the meal, with the meal, after the meal. So it changes. So I don't have a particular wine I like, but I like the more complex, less sweet, more earthy wines than the sweeter fruit-based wines.
We are a lot alike.
Well, we'll have to have a glass together.
I know, I love it. And one other thing, if during this COVID, what is a lesson learned that you know you'll take forward and use and continue to use that you've learned during COVID?
COVID has taught me patience
Mm,
because nothing was happening quickly. COVID has also taught me how to utilize my time in a different way because I was so busy pre COVID, traveling constantly, really on a very fast paced track. I want to say in fifth gear, going around a racetrack. Well, with COVID, travel stopped, meetings stopped, uh, evening events stopped. But I was able to really focus and remain busy, but not as crazy busy. And I'm able to balance life better. There's more downtime to enjoy time with my husband and my family. Our daughter and I have two grandbabies, so I get to see them much more. And fortunately, my daughter and son in law and their two kids live an hour away from us. So we get to see them. They're in our bubble. So I'm enjoying so much family time. And I feel these moments were meant to happen.
I agree. I love that you have grandbabies. I'm jealous. I want them. Oh, my two
You
boys.
can come visit mine
Yeah,
anytime.
I rent people's grandchildren. I'm like, I'll take your grandchild. I'll take your baby, whatever. Yeah, I have a dog, and that's okay. There's one last question that we do ask, and we're trying to get everyone to answer this. We're asking different questions too, just so you know. There is one other thing I want to ask you because I love this. Who are the people that are your go-to people for advice in the industry or anything, your patients, your practice, your business?
I have different go to people depending on the issue at hand. I have people within industry I lean on. They're good friends, they're mentors, they're advisors. I have colleagues I lean on if it's a complex clinical situation. And then I have other friends on whom I lean for business strategies and trying to figure out which business maneuver would maybe end up with a better result than a different option. So I kind of have different groups of people, and they've always been there to help me whenever I've reached out to them.
I love that. I love having all different people. I think that's what gives us a little bit of flavor is to have different people in our life. It helps us see, it gives us perspective, I
Yeah.
think, things. Yeah. Um, how have you seen the technology in ophthalmology? We've talked a little bit about this, but how have you seen it transition since your career started? And what do you foresee and to be one of the biggest things coming? I know we talked about presbyopia, but maybe otherwise coming in technology and ophthalmology.
The speed at which technology is progressing is absolutely amazing. When I first started out, we had an a scan, biometer where we had to touch the cornea with it and probably were indenting it and getting incorrect axial length. But that's all we had in a visual field and a slit lamp, of course, and that was it. Now, the diversity of equipment, from testing equipment to diagnostic equipment to OR equipment to guidance systems, head up surgery, light adjustable lens. I mean, it's unbelievable what there is. It's harder to keep up with all of it because we're not only surgeons, not only physicians, not only clinicians, but also we have to keep up with all the technology that surrounds us, which is almost a full-time job. And of course, there's a cost associated with all of that. And I do believe that eventually cataract surgery will probably move into an office-based procedure, just like it went from a hospital procedure where people were actually admitted and spent a few days to an outpatient procedure. I believe it is going to move into more commonly into an office-based procedure. It's already happening, but it's not standard yet, but I believe it's going to do that. The other thing that I think we're going to be able to trial what looking through a presbyopia correcting lens will feel like. So just like any other purchase we make, we try out a car, we go and visit a house before we buy it. We should be able to trial what the vision is like and at what distance we wish to see so that we can choose appropriately. The light adjustable lens is coming close to that, but it's a monofocal lens at this point. So to be able to trial it before getting it in the eye, I think will be a huge evolution.
I love that. I would love, I hope I see that. I would love to see.
Me too.
Yeah. I'm going to end with this because I like to end with something humorous. What is one of your most memorable, funny moments in your practice that have happened to you that you remember and will still laugh about today?
Well, there are so many that I could go on and on and on. But, patients are funny, they're loving, most of them are so appreciative of what we do. But one of the funny episodes is that we have brooder masks that we sell in our practice as one of the at-home remedies for dry eye disease. So I had given the patient a brochure about the brooder mask and told him that he could either go online and purchase it or buy it from us. When I saw him back, he brought the brochure back and it looked kind of dried out and cracked. He said, I've been putting it in the microwave and putting the brochure on my face, and it hasn't helped me much. I had to crack up. I said, I can't believe it's not the brochure that you put in the microwave. It's the mask that you have to put in the microwave. But clearly that's what he understood, and that's what he was doing.
That is the best one I've heard so far. That you have that
So funny. It is so funny, but it's a true story.
Did you tell Mark Bruder that?
I have not actually. I should tell Mark and Mary that story.
Absolutely.
It's crazy. It's unbelievable.
That man a lifetime of Bruder mask for that. Well, Dr. Matossian, thank you so much for joining us this evening. We have had such a good time with you, and you're brilliant in all things, and we so enjoy your time, and thank you for it.
Well, thank you. This has been so much fun. Polly, lots of luck with the rest of your interviews.
Thank you. Bye-bye.
Thank you. Bye-bye.